Again, I'm not going to be presenting anything new, but just some interesting aspects of things from studies you've already seen. I don't have any disclosures except that there might be a little bit of physics involved here, but no nerdy physics, just kind of pop physics, okay? So when we think of artifacts and pitfalls, actually we lump them together and they kind of lead to a similar problem, but they're actually different. The way we have to address them are different. Artifacts are mainly due to technical factors. So the way we inject patients, the acquisition, the protocol, the scanner technology, reconstruction, implementation, and it's independent of radiotracer. So when you think about that, the way we have to solve the problem is a little bit different. Whereas pitfalls is really all on us in interpreting. You know, it's what we do with those images. So we have to know about the radiotracer distribution. It depends on those properties. There's false positives and negatives, and it could be a perception problem. And in that way, it could be related to artifacts. But think of them differently, and that'll help you figure out how to address the problems, okay? So gamma camera technology, and again, this is advancing. This is this is kind of the older fashioned cameras before solid state, but it's relevant to some of the artifacts we see and we have to be able to recognize. So we have an array of PMT photomultiplier tubes, and you can see here they're in a 2x2 array, and they look like cylinders, and then they're on top of a crystal, and then a collimator, and then there's technology to localize where the activity happens. So what's important is that for quality control, uniformity and collimation are two factors that you have to think of in terms of when we look at images and potential problems. So every day we do a flood study, and what this shows is if you put a uniform source, so this is cobalt 57, it should be really a uniform image. But if you image too short, there's going to be so much noise that it's not going to be uniform at all. And the longer you image, the smoother it gets. But it's going to approach perfect, but it's never going to quite be perfect. But this shows you have to image for a long enough period of time so that you can really determine whether or not there's any non-uniformities here. And just think about this. This is your camera. Any non-uniformities here, if there's a dark spot here or a white spot here, that's going to show up on all of your images for the whole day. So that's why this is important. And it's important when you see an artifact to think, well, could it be related to this? So example, here's a dead PMT. So it's going to be that round in this case, and it's going to look like this. Now in this case, it's obvious. But if you were doing, a liver scan or something, you saw this thing, you might think it's a cyst or something. So, the key is that it's going to show up on every image, right? And also it kind of has an unusual appearance and localization. So this is one of the uniformity artifacts that you would pick up if hadn't done if you had looked on the uniformity study. Here's another image of a patient for yttrium-90, and in that case, the uniformity had passed, but it was at the standard energy, 57, cobalt 57, but not to account for the photons from yttrium-90. So because of that, you had this artifact, and this kind of, again, looks similar to what we saw before. It's like, it has the honeycomb shape of the collimation. So it has to do with the linearity correction because the energy is different from what the uniformity was calibrated at. So now if you had the correct uniformity correction file for the yttrium-90, then it's all uniform, and then you lose that artifact.